And here you go. So that's where we left. I loved your table. It uses this tool called Data Wrapper, and I think I will be using it myself because it allows you to embed it directly into Substack so people could even cut and paste the numbers. And I guess you submit it as a spreadsheet, or how do you submit
Yeah,
data to this data wrapper?
when you create a free account on dataraper.de, there's a web tool on how to uh, input your data. You can copy paste it. You can upload a spreadsheet. You can upload a CSV file. And then after that, there's a sequence of prompts that allows you to give a little bit of formatting to your data, such as colors with columns and rows and whatnot, and how to sort it and so on, right? But this is something you can look at another time.
Yeah,
Let's go
and
back to the
I see
discussion.
you have two tables here.
Yes.
So can you tell us more about these two tables?
Okay. Are we recording?
Yes, and we are recording.
Good, good. Okay. So the data tables of the AEFI of the COVID vaccines in British Columbia. So in my second Substack, I transcribe the non-public AEFI data at two dates. From the FOIA request, I transcribe them into the Substack. So and they're in the supporting tables of the second Substack. And we have the AEFI rates in British Columbia as of March 15th.
That's right.
And we have also the AEFI rates as of September 15th, 2021, 6 months later in British Columbia. The main difference is that on March 15th, on March 15th, we had 14 lots of Pfizer and Moderna that had been like distributed. And then 6 months later, we were up to 64 lots. So um, that's the key difference. The uh, 6 months apart, the two data tables, they show the same picture. They show that uh, there's a wide variability of AFI rates across vaccine lots. So this means that it is clear that the manufacturing of the product is defective. You're not supposed to have that kind of variability in a drug across like lots, manufactured lots. That's that's a no-brainer. You're not supposed to have that. Now,
Can you tell us more about this table, Alex, just to explain us better?
yes, yes,
Uh,
exactly. I want because I want there's something important here is I want to talk about the public perception of the COVID vaccines. And I want to talk about why the public is divided over it. And this table can reconcile the division in the public. Here's how to look at it. You have vaccine lots that are like extremely harmful, and you have vaccine lots that are not so harmful. And this is why a lot of people, they took the COVID vaccine and they were able to go about their daily business without too much interruption because they got like a relatively like less harmful COVID vaccine. But there's a significant percentage of people who got like a very harmful lot. And this is why the public is divided because you took the vaccine and you felt fine after it, and then like your neighbor took the vaccine and he just got like a very toxic lot. And that this is why you have a different experience of the COVID vaccine, right? This is why the public is divided. You're talking about a different product. One of them is super toxic. Someone got like a less toxic. Okay. Now, I want to talk about these table, and one thing they're showing here is that I'm going to talk about benchmarks, about like relative harms with respect to a benchmark. Now, the BCCDC, when it monitored the rates of adverse effect following immunization, it was comparing the rates with the with the flu shot that people take every year, right? So we have like the flu shot, the flu vaccine, and the flu vaccine also has like sometimes adverse effect following immunization associated with it, right? It comes, right? And the what's important here is that the historical rate or the average. So AEFI rates are measured by the number of AEFI per 100,000 shots, right? That's how they measure it. So the if we consider like all total AEFIs, it means like it could be a simple headache, it could be hospitalization, it could be nausea, it could be anything, total AEFIs. The flu shot, its historical rate of adverse effect following immunization is 6.6 per 100,000 doses. Now, if you take AEFIs, total AEFIs, and you do a subset of serious AEFIs, and generally a serious AEFI is an AEFI that requires like medical care. You need to go to the hospital. You need to consult with your doctor. Your your daily activities, you're no longer able to do your daily activities because you're having let's say like you can no longer lift your right arm, like you know your it hurts, like it's serious enough that you cannot conduct your daily activities. Then that's a serious AEFI. I mean, the BCCDC has its own definition of AEFI, of what is a serious AEFI and non-serious AEFI. That's a different topic that I would like you to remind me to talk about later. It's an important topic. But for now, as far as this table is concerned, you've got total AEFIs, you've got serious AEFI, which is a subset of total AEFIs. Now, so we have two baseline rates of the flu. So 1.5 serious AEFI for the historic flu and 6.6 for total AEFI for the historic flu. And I put it at the top of the table, and then we compare those benchmark with the AEFI rates of the COVID vaccine. And what we see here is that pretty much like all of them, all the COVID vaccine, except like maybe a couple of batches, they all had like, you know, total AEFI rates and serious AEFI rates that were like multiple times higher than the flu shot. So this is important because if the public added its mind that, hey, there's a deadly illness, there's a COVID pandemic, we're at risk, we need to take a vaccine. And people in their mind, from their own personal experience of vaccine, they expect something that is safe. And in their mind, in the mind of the public, safe means like you take a flu vaccine and then you continue with your daily activities without interruption. And you're not supposed to have a stroke. You're not supposed to have to go see your doctor, and none of that is supposed to happen. It's safe. That's in the mind of the public. So here we're seeing that the AEFI rates of the COVID vaccines are several fold higher than the flu vaccine. So the
Alex,
public has been deceived.
yeah, I think this is one of the most important pieces of evidence which should reconcile, in fact, anyone in Canada or elsewhere in the world. Let me just emphasize something here. So, you know, spinach is safe and efficient. Eat spinach, guys. Just buy it and sell and eat it. It's good for your health. But occasionally we do have salmonella. You know, things happen. And then when there is salmonella, then this batch, particular batch of this salmonella from this plant is just removed, and there is a notice sent to every clinic. No, not
There's
clinic.
a
Every
recall.
store.
There's
Every
a
store.
recall.
Remove this batch of spinach, such and such
Yes.
lot. So to me, this is not different whatsoever from anything which is sold anywhere for consuming. And what we can see here that indeed spinach is normally safe, but occasionally it has salmonella.
Yeah.
And
Yeah.
Moderna, let's assume it's safe generally, but occasionally it's not as safe. And we can see that even here we see it sometimes it's 5 serious effects, and this could include very serious things, like
Yeah.
including
So
death.
the one you're pointing at here is like this is as March 15th, and the public needs to understand that AEFI reports, there's a lag between the time that the patient, the person is experiencing the AFI, then the patient goes see the doctor, then the doctor files the AFI reports, and that takes a while until it shows up in the data of the BCCDC, right? So in those two tables, there are two benchmarks that are important. The first one is the flu rate benchmark. There's another benchmark that occurred, another safety benchmark that is more permissive that occurred in March 2021. And that benchmark is the AstraZeneca vaccine. So around March 2021, reports came, started to appear around the world that it was tied to blood clots, right? And as a result of these safety signals uh, re related to the AstraZeneca vaccine, public health authorities decided to curtail the distribution of AstraZeneca to a certain age group. So they said like at the I think it was at the end of March or the beginning of April 2021, the health authorities said like, look, we're picking up some safety signals with the AstraZeneca, and we're going to curtail its distribution to I think it was the age group like 55 to 65, something like that. But the point here is that once you do that, you're establishing a benchmark of safety, right? It becomes like, if public health authorities deem that the AstraZeneca vaccine is showing safety issues such that they need to curtail its distribution, then they should apply that same standard to the other vaccines, Pfizer and Moderna, right? So the the BCCDC data from the FOIA request does not show the AEFI rate of AstraZeneca as of March 15, 2021, but it does show it as of September 15, 2021. So that's a little bit fast forward in the future with respect to March. And so that's why I put a note that the AstraZeneca rate that we see in the March data is actually, it's coming from the future. It's coming from September, 6 months later.
That's right.
But it is still a benchmark of safety because around the same time, health authorities decided to curtail the distribution of AstraZeneca. And what we're seeing here is that the AEFI rates of Moderna and Pfizer, even in March, are much higher than AstraZeneca. Like maybe like approximately like 80% of the vaccine lots had like higher AEFI rates than AstraZeneca. And then we see the same thing in the September data. So if you go to the September table,
Yeah, that's the
then
one.
yeah, that's the September table. We see that the at that time the total AEFI rate of AstraZeneca was 76 AEFI per 100,000 doses, and we see that we have like several lots that are significantly more harmful than AstraZeneca,
And
right?
including the one which has been reported by Dr. Ho.
Of course, like
Let,
the lot the Dr. Off Moderna lot, as far as the BCCDC data is concerned, as of 2021, is the second most toxic lot, right? And that's why he was persecuted by the authorities because he was causing them to do their job, which is like to analyze and react to a cluster of harms,
uh,
right? Yeah.
so so Lex, I would need to wrap up our discussion for today. I think the key, most important pieces of evidence is really these two tables. Let me tell you now what I am going to do here. I'm a data scientist myself, and I'm also talking on behalf of many members who expressed concerns related to transparency overall related to mandates and safety and efficacy concerns related to COVID vaccines. So I have this website, which is my own website, which collects evidence related to many issues. But one of them is specifically data which comes from data. So there is a link to, for example, how bad is my batch?
Yes.
And what was interesting, I just put your, not your, not your, but Dr.
I need
Hoff.
to speak. I need to speak to this. Is that the data source of how bad is my batch? I believe it's coming mostly from VAERS data, mostly,
That's right.
which is
But I just
which is
looked,
United
I just
States
looked into
data.
it. Now I just typed, you see, I typed this particular lot. You
Yes,
see, you recognize
yes,
it. Look
yes.
here, look here. It's amazing.
Yep.
Number of, so 13 deaths, 25 disabilities, and so on and so on. So, you know, I typed some other lots of those of my relatives, myself, and they were okay. There were no deaths, for example, reported for other lots.
Mhm.
So here you go. You have a case of salmonella, or even worse than salmonella,
Yep.
you have a case of
Dimitri, um, I would like simply to bring your attention to an important conclusion or idea that I covered in part two. And if you move, if you go to a section titled like Systematic Public Health COVID-19 Vaccine Harms Management in BC.
is it
So
the
it's
one?
at the, yes, that's the one. So let's scroll down a bit. Um, okay. And you should see like a small table of the
Yes, that's the one.
okay, this is what I would like the public to look at. Okay, this is very important. Okay. The BCCDC AFI data gives us on a vaccine lot basis, it gives us the rates, total rates of AFI and serious AFI rates. And it also gives us the number of AFI and total EFI. Using these two data points, you as a data scientist, you can understand that it's easy to compute the number of, to derive, to infer the number of doses administered,
Yeah.
right? Because it's simply like a question of working out the math, right?
Yes. Yes.
If you have a rate and the number of incident, then you can figure out the denominator, like how many doses per vaccine lot, right? So this is interesting because what we see here is that the number of doses administered for the 15 most harmful lots, the total number was like 393,000. This is as of September 15th, right? And it represents like 5% of the doses, right? If we take the least harmful COVID vaccines, right, we see like the 15 least harmful, we see that's like 2.7 million doses. And it represents like 36% of doses of all doses.
Yeah. Yeah.
This is to explain, to drill into the public the idea that you have like a a significant smaller percentage of doses that are very harmful, and it just so happened that their distribution was much less than the least harmful one. Okay? This is, in my opinion, evidence that public health had some kind of methodology to curtail the distribution of harmful lots. So I believe they silently curtailed the distribution of harmful lots. And this is why we're seeing that the lots that have the highest rate of harm are the least distributed. This is very important because it ties to that the bureaucracy knew about level of arms, they knew about like excessive level of arms, and that they curtail the distribution in order to protect the mass vaccination agenda. It was like, they simply could not inform the public like, hey, by the way, you've received like a harmful dose, go see your doctor. They couldn't do that. It would have crippled the mass vaccination political agenda. It was never about public health. People need to understand that, right?
Yeah.
It served a political purpose. So so the data shows that knowledge of harm, of excessive harm, and it shows that they manage the distribution of excessively harmful COVID vaccine lots. That's very, very important.
Yeah, so in some sense, they have done their best to minimize the casualties, the number of casualties.
They did well, it's not they did their best. If they would have done their best, they would have stopped the vaccination program,
But they
period.
believe, because you remember, they believe that this saved the world. Vaccines save the world. That's their
Well,
mantra.
okay. Actually, the point of the second Substack on this topic is that public health authorities knew that the COVID vaccines were more harmful than that the harms far outweighed the benefits of it, and they went along with it anyway. This is very important. So the public health authorities, like, they don't have the excuse of like saying like, well, at the time, based on our data, we believe it was safe and effective. No, they had no grounds to believe that. All right. They pursued a political agenda. That's what they did. That's the truth.
I'll
And they
tell you the
concealed
message.
it.
Yeah, I'm telling you the message which I keep hearing in in the organizations. I will not name them. We trust our pilots. When the plane is going through the storm, you, the passenger, don't ask the pilot to tell the pilot what to do. We're right now going through the storm, through the pandemic, and we trust the pilot. And they were given instruction that vaccine is the way to stop the pandemic and to save the humankind.
Yeah.
So they got this perception, whether it was just a naive belief or maybe they just followed the orders. We don't know. But
Here's
I think that's
here's
what we
what I'm
should
going to
do.
say is that in the case of the COVID vaccine rollout, the pilot was willfully incompetent.
Uh,
Was
I know that
so
myself. As I mentioned to you, I have another website here which I specifically dedicate to supporting the union members' concerns. And there is one page called here political interference, and it's in here where show, for example, that cases following vaccination were reported by our PHAC colleagues in such a way as to create illusion that people who got more shots die less, when in reality, when you recompute it using
yeah.
weekly statistics rather than from 2020, you see that people who got 4 or 3 doses died of COVID more than unvaccinated. So to me, I just show this as evidence of manipulating political interference, manipulating the data so it fits the narrative. I'm going to add your data into this page, so it will be another data evidence. I have data evidence for any issue which
Yeah.
many people express, and I think you just showed us the data, which is remarkable in the sense how clear it is in terms of batch variation and how they knew about it.
Well,
So I will just add it right here.
yes.
So
There for the public is who's interested in data. Um, I have some key points that summarize this. I can read them off. It's there's a section of the second Substack. It's subtitled like the alarming COVID-19 vaccine reality. If you can find that section, it's
yeah,
right
I'll
above
find it.
the
Fine.
just oh,
I'll
next
find
one.
it. I'll find it.
All right,
Yeah,
this is it. So the public can your audience can simply look at these bullet points here is I summarize the data is as of September 15th we of 64 lots that had been distributed 59 were like at AFI rates like higher than the flu, right? That's 92% of them, right? That is very important, right? And then what do we have here? The second point is I've already talked about it is the high variability of relative risk. Well, relative risk is simply it's simply let's say like you have you divide the rate of AFI of one vaccine lot with the AFI rates of the flu. And we see that those COVID vaccines, depending on which lot you were looking, the rate was like they were like 1.2 to 85 times more harmful than the flu, right? It's very important. Now, what you're looking at here, this is probably at a different time. This is around March, okay? So depending on that, which point in time you're comparing the rates with the flu, then you get different like factors of relative harmfulness. So let's go back to September, this small grid. We know that the data is showing like 27 out of 64 lots. They had like a higher level of harms than the AstraZeneca. So I remember that AstraZeneca is another like safety benchmark that occurred that emerged in March and April 2021 when they decided to curtail it for like due to like safety signal. Then de facto, AstraZeneca became like a different standard of safety. And yet, like, by September, we have like 42% of the vaccine lots are still more harmful than AstraZeneca, right? So, what else do we have in this summary? We have that 22.4% of all COVID vaccine doses administered in BC, well, they came from lots more harmful than AstraZeneca. This is exactly what I was saying here.
Lex, so at this point, I think we got a lot of information. What I will
Yes.
do now as a data scientist and also as a service for my community of members whom I would like to help with the data evidence. I believe this is very important data evidence, and I will do my best just to take your numbers, even not much commentary I think is needed at this point. Just the numbers, the tables, and I will put them into my two portals. One is which is dedicated to supporting the members, the member and addressing their concerns, and the other one which is IVIM.ca, where I just collect all sorts of evidence on different issues, which is for whatever reasons is not discussed widely on by our mainstream media. So I think this would be a nice conclusion for this presentation. I thank you very much. I do value very much the analysis of data which you have done. You've shown me the way to publish them through this portal. I will learn and I'll use it myself. And this will be exactly the data which I will be showing in my on my portals, so that any member, any public servant, or any Canadian would be able to easily go and get this evidence. So evidence which comes from data, I call it from evidence which comes from data. And I have built my own web applications, for example, that track vital statistics for Canadians. And we have other web applications which visualize data. And by the way, we become friends with many of those developers, including Craig. For example, Craig, we talked to each other back in 2022. We had Zoom meetings with him, just trying to build applications. So I use slightly different technology to visualize them and to process them, but we are talking about the same issues. So again, I thank you very much. This is very, very important, the work you've been doing. And maybe something else you would like just to pinpoint the audience in terms of how they should read your two articles. There are two
What kind of
articles here.
mindset? What kind of mindset they should have? Well, well, of course, I have a bias. I mean, I have my own set of belief, and what I would, what I'm hoping is that there's a lot of people who are unable to admit that they've been deceived. This is important. It doesn't, as far as I'm concerned, like at this point in time in 2025, people don't care about data. Only very rational people care about data, you know, but the public in general, like 80% of them, ballpark, took the shot and they went on with their lives. And for them, it's something of the past.
And they believe it saved them, it helped them. So
But
again,
I think it's important for them to understand that they have been deceived, right?
I think it's not our business to tell them what to do, but we can just publicize information which is not
Yeah.
publicized by our mainstream media. And again, let's just finish the discussion with two major developments in the United States. Our
Yes.
our neighbor here, who now recommends against COVID vaccines for general population, and you
Yep.
can see full discussion. It's like half-day discussion with lots of evidence
Mhm.
on the harms versus efficacy. And a month earlier, there was a statement from Health and Human Services, which is equivalent of our Ministry of Health in Canada. So this is the top ranked official in the United States who is
Yep.
stating, who is declaring that mRNA injections are not effective and the risk outweighs the benefits.
Exactly. And this is a conclusion. This is a conclusion that the BCCDC should have reached or refused to admit.
Now it has become
Yeah.
possible only because he was elected. Let's just
Mhm.
remember that. If he were not elected, we would not be hearing this type of official rhetoric. So we have to understand there is effort, huge effort of everyone to hide this information from everyone who was implicated, big pharma, and everyone in between. They are not happy about this information being exposed. And it is only now that we have this historic shift that this type
Yes.
of information is not only discussed by you and me, but by the top officials in the United States. And I believe this gives us right and in fact the duty to express the same concerns and follow up on what we know, what you know, what I know. I met many members and I have interviewed some of them, including the person who almost committed suicide because he was removed from the society. He lost everything because they just required him to do the vaccine and he just religiously could not do it. He would rather die, commit suicide, than take this thing which he could not take. So again, at this point, we are now experiencing a historical evolution. You know, pendulum is going back. There is more opportunity for you and for me, the public servant. And again, I do it always on my own time. I always do it in support of many members within the community, including my colleagues. But it gives us more weight, it gives us protection as well.
Mhm. Very well.
So,
Well, Dimitri, thank you for the opportunity to present a little bit of the message here. And you're welcome to set up like more interviews if you want to
uh,
if you would like me to go over like different aspects
yeah,
of this topic.
it, it just the amount of information is overwhelming, and people focus of
Yeah.
attention is very short and normally limited to
Yeah.
bread and entertainment. You know, as they say, all you need is a bread and entertainment, and you're already busy with your other things.
Yeah.
So, but I still I'm very active in my schools, in my sport clubs, at my work and union, and I just try very gently introduce this type of idea that it happens even with spinach, and of course it happened with the vaccines, and it's good that right now in the United States they are putting more transparency into that. So let's us applaud the efforts from United States, and we should be trying to do the same, and this is what we are doing. So again, thank you very much.
Yep.
On this optimistic note, I wish everyone to have a good day.
Okay, goodbye.
Bye bye.